Starting.
Screenshot anta.
I kindly request all the delegates to be kindly muted yourselves so that to avoid unwanted disturbances. Am I audible? Namaste and a very warm good afternoon to all the distinguished guests, HOIs of various institutions, faculties, beloved parents, and dear delegates. When you judge someone based on a diagnosis, you miss out on their abilities, beauty, and uniqueness. Myself, Mrs. Gautami, Assistant Professor, feels honored and privileged having an opportunity to be the host for today's event. 21st World Down Syndrome Day is commemorated as a global initiative to increase awareness about the hereditary disorder. An individual with Down syndrome has an extra chromosome. Every year, almost 3,000 to 5,000 infants worldwide are born with this chromosomal abnormality. According to the CDC, a baby usually have 46 chromosomes on an average. But babies with Down syndrome have an extra copy of a chromosome on chromosome. Together, we can empower people around the world, advocate for full inclusion in society for people with Down syndrome and for everyone. So, in order to bring awareness among the parents as well as all delegates, we have organized this webinar on World Down Syndrome Day. Welcome you all. So, here and great welcome makes a celebration. Without a further ado, I now invite Professor Mamta Nischal, HOD, Medical Surgical Nursing Department, to welcome the beautiful gathering with the sweet aroma of happiness through the words of welcome. Over to you, ma'am.
Thank you, Mrs. Gautami. Am I audible?
Yes.
A very warm good afternoon to each one of you present today. I'm extremely delighted to welcome you all to today's webinar on empowering individuals associated with the person with Down syndrome as a part of observance of World Down Syndrome Day. Having Down syndrome is like being normal. I'm just like you and you are just like me. We are all born in different ways. That is the way I can describe it. I have a normal life. With this strong message by work, American actor and folk singer, I'm Mrs. Mamta, professor and HOD of MSN department, feels privileged to welcome the August gathering. At the outset, first I would like to welcome the resource persons of the day, Dr. Ushma Goradia, founder of Active Karya, which is world-class physiotherapy and sensory integration center Bangalore, and Mrs. Tejal Shah, founder, Bangalore Humsafar and Happiness is Kushi, which is a parent support group for researchers. In spite of their busy schedules, they have consented to be resource persons and are willing to enrich us with various aspects of Down syndrome. Gautami, was I audible? Gautami?
Mamta madam, we can hear Mamta madam.
audible, sir?
Yes, madam. Please continue, madam.
I think it got connected. I'll just welcome again the gathering. Sorry for the interruption. Thank you, Mrs. Gautami. A very warm good afternoon to each one of you present today. I'm extremely delighted to welcome you all to today's webinar on empowering an individuals associated with a person with Down syndrome as a part of observance of World Down Syndrome Day. Having Down syndrome is like being born normal. I'm just like you and you are just like me. We are all born in different ways. That is the way I can describe it. I have a normal life. With this strong message from Chris Burke, American actor and folk singer, I, Mrs. Mamta N., Professor and HOD of MSN Department, feels privileged to welcome the August gathering. At the outset, I would like to welcome the resource persons of the day, Dr. Usma Goradia, founder of Active Karya, which is world-class physiotherapy and sensory integration center, Bangalore, and Mrs. Tejal Shah, founder, Bangalore Humsafar and Happiness is Kushi, which is parent support group for children with special needs. In spite of their busy schedules, they have consented to be the resource persons and are willing to enrich us with the various aspects of Down syndrome so that we are enabled to empower the individuals and the community to a larger extent. We are extremely delighted to have such an eminent personalities and the dynamic persons amongst us today. On behalf of RVCN family, we wholeheartedly welcome you both, ma'am. Next, I extend my cordial welcome to the organizing chairperson of today's webinar, Dr. S.R. Gajendra Singh, Principal RVCN. Sir has been continuously providing enthusiastic support, encouragement, and guidance in organizing the webinar. On behalf of RVCN family, we welcome you, sir. Next, I extend my amiable welcome to all the delegates who are attending today's webinar. On behalf of RVCN family, I thank you for showing interest in the event and being with us. Your valuable presence in this event is acknowledged with a lot of gratitude. Last but not the least, I welcome organizing committee and congratulate them on having hosted such a meaningful session. I welcome you all once again. I would like to sign off with a quote: "We cannot change the outcome, but we can affect the journey." Thank you one and all. Have a pleasant and fruitful session. Thank you.
Thank you, ma'am. Self-belief and hard work will always earn you success. It's my deep pleasure to invite Dr. S.R. Gajendra Singh, Principal, Organizing Chairperson, RVCN Bangalore, to deliver the inaugural address to the gathering. Over to you, sir. Just a second, delegates.
I'm sorry, sir, but we are not able to hear you.
Sorry for the inconvenience caused. wait for a few seconds. Kindly request the delegates to wait for a few seconds. Kindly request the delegates to mute yourselves to avoid any unwanted disturbances.
Good afternoon, everybody. Today we are lucky to have the eminent founder of Active Karya. Good afternoon, everybody. Today we are lucky to have the eminent founder of Active Karya, Dr. Ushma Goradia, and the founder of Bangalore Humsafar Parent Support Group. Good afternoon, everybody. Today we are lucky to have the eminent founder of Active Karya, Dr. Ushma Goradia, and the founder of Bangalore Humsafar Parent Support Group as a resource person for today's webinar. We are happy to have such an eminent speaker today. 21st March of every year is celebrated as World Down Syndrome Day to care and encourage people with Down syndrome and their families. I take this privilege to share few words on this year theme, inclusion. Inclusion means together we can empower people around the world, also advocate equal rights for all children, including differently abled children. According to the recent statistics, the incidence of Down syndrome in India is 1% for 850 to 900 live births. It is one of the most commonly occurring chromosomal abnormalities in India, and children born with conditions have an average life expectancy of 50 to 60 years. The prevalence of Down syndrome in United States is 1 in every 700 live births. People with Down syndrome have 10 times the risk of COVID-19 deaths. Medical costs for children with Down syndrome are 12 times higher than for those without this syndrome. So, keeping all this in our view, we the nurses should more focus on preventive aspects rather than curative. Also, educate people on how to screen for Down syndrome in early stage of pregnancy. Thank you, one and all.
Thank you, sir, for devoting your precious time and endowing our delegates with your wonderful words of wisdom and experience. To decipher the concepts on overview of Down syndrome, we have a renowned speaker amongst us today for sharing her valuable knowledge and experiences. Gaining knowledge is the first step to wisdom. Sharing it is the first step to humanity. At the foresight, we are extremely delighted to welcome the eminent speaker of the day, Dr. Ushma Goradia ma'am, founder of Active Karya, world-class physiotherapy and sensory integration, Bangalore, to decipher the talk on overview of Down syndrome. I now request Mrs. Uma Maheshwari, HOD, Child Health Nursing Department, Organizing Secretary of today's webinar, RVCN, to introduce the eminent personality, Dr. Ushma ma'am, to our esteemed audience. Over to you, ma'am.
Thank you, Gautami ma'am. I'm very much honored to introduce the eminent speaker of today's webinar, Dr. Ushma Goradia, founder of Active Karya, world-class physiotherapy and sensory integration, Bangalore. Dr. Ushma completed her Bachelor of Physical Therapy in Mumbai, 1986, and pursued advanced Masters in Pediatric Physiotherapy in United States in the year 1990. She holds clinical doctorate in Pediatric Physiotherapy in USA. Madam has many add-on qualifications and certifications and being the best practitioner in the field of sensory integration and certified by the University of Southern California in the year 2010. Extensively trained in neurodevelopmental treatment and ball therapy. Proud to introduce, Madam is a pediatric certified specialist by American Physical Therapy Association in the year 2012. Madam is an astute physiotherapist with more than 30 years of clinical hands-on skill experience. She has 17 years of clinical experience in United States and holds an active New Jersey license. Her 15 years of clinical experience in India includes Active Karya, teaching workshops on sensory integration and neurodevelopmental treatment. And she was also a faculty of RGHS, Bangalore. Dr. Goradia's passions for physiotherapy has culminated into Active Karya that offers world-class physiotherapy for patients of all ages and diagnosis. Dr. Goradia is highly experienced in empowering parents and to choose optimal intervention for the children with special needs, helping them to achieve their children's highest potential in functional as well as academic area. We are proud to have such an eminent speaker in this online platform. Thank you, ma'am, being here, and over to you, ma'am.
Thank you for your kind words. Thank you for your kind words, Uma ma'am. And I think we should start my presentation without delay. So how do I share? I have my PowerPoint open. How can I just share? Can I just share it? How do I share?
Yes, ma'am. At the bottom, you have an upward arrow, ma'am.
Yes. Okay, got it.
You click on it, ma'am.
Okay. And then my screen. So what do I click on that? My entire screen?
Entire screen you can click, ma'am.
Okay. And share now. Share
you
now.
can click on it and then start share now.
Okay, great. Okay. But my PowerPoint doesn't show there. So
after you click on entire screen, no, ma'am, you'll get a tab. You click on the tab and then you start share, ma'am.
Click on the tab. Okay, got it.
Yes.
Understood. Got it.
Try to do it again, ma'am, so that you'll be able to present it.
No, I'm now, okay.
Yeah, it's coming.
It's coming. Okay, got it.
It's presenting, it came, ma'am, but we are not able to see it still.
Okay, maybe 1 or 2 seconds you may want to wait and it comes, or should I do stop sharing and do it again?
Yes, ma'am. Stop sharing and you can start.
Ma'am, you can see now.
You can see it, right? Okay, great.
Now it got closed.
Because I said stop sharing. Okay, I'll share. I'll share again. Okay. I have to go. Yeah, I think it just takes 2 seconds. That's it. Okay. So hopefully I'm audible and I'm visible. My slides are visible also.
Yes, ma'am.
Yes. Okay. So Down syndrome, the previous speakers or whoever introduced us, welcoming everybody as they have, spoken a lot about Down syndrome, and, they've already given a nice introduction. And today is World Down Syndrome Day. I believe it was March 21 or March 22. I don't know. The message was confusing to me.
21.
Yeah, okay. But nevertheless, we are all here to recognize it, accept it, and, celebrate the neurodiversity that we have in the world. So I have, in my own experience, I have treated many children with Down syndrome back in the 80s and the 90s while I was in the United States. And it's just a coincidence that in India, here in my clinic, I've had only one child with Down syndrome so far. And a child who learned to walk in my clinic, learned to do everything in my clinic. So, it's been a great journey, and I don't know whether the numbers are increasing or decreasing because I don't get too many children with Down syndrome in my clinic. I have not been able to follow up with the research. But yes, years ago, I have worked extensively with children with Down syndrome, so I can share with all of you, what it is. And one thing I can say is working with children with Down syndrome is a lot of fun. They're very lovable. They're very, eager to do things, whatever you want them to do. And generally my therapy is a combination of what we call sensory integration, neurodevelopmental treatment, motor learning. So I use many aspects of pediatric physiotherapy techniques, and I also include play a lot. So my therapy is more done in the form of play, and that's why it's a lot of fun to work with children with Down syndrome. So as it has already been said, it's the most common chromosomal disorder. It also comes under the umbrella of developmental disorder. When we say developmental disorder, that means it impacts or it affects all the aspects of development. That is motor, intellectual, sensory, all the aspects, speech. Again, there are some medical aspects also. So this comes under the large umbrella of DD, what we call, or developmental disorder. It's the most common autosomal trisomy. So, trisomy 21 means that we all have like a pair of chromosomes. So here in the chromosome 21, instead of 2 chromosomes or a pair, there are 3 chromosomes. And in general, the extra chromosome is contributed by the mother. Now, there are types of Down syndrome, depending on the chromosomal pattern or the chromosomal presentation. It's known as autosomal trisomy, but there are also 2 more. So there is one is translocation. Translocation type means, yes, there is an extra chromosome 21 or a part of extra chromosome 21, but it is not attached to 21. It is attached to some other chromosome rather than its own self. And then there is another rare form of Down syndrome, which is called as mosaic type. And mosaic means that all cells do not have the extra 21. Only some of the cells have extra 21, and therefore it's called mosaic. But regardless, the 3 types of the 3 types of presentations in the chromosomal pattern will tell us a lot about their presentation physically, mentally, emotionally, in every way. So generally as therapists, we don't really go into, which type do they have, but we generally only focus on the function. So now, many parents in the past also have asked me, and, recently also somebody asked me, how does Down syndrome happen? Advanced maternal age is a strong risk factor. Again, it's a risk factor. And back in the 80s and the 90s in the United States, if a mother who has conceived after the age of at 35 or after 35, they would do a mandatory test of the amniotic fluid. So they would insert a needle into the abdomen and draw the amniotic fluid and do a chorionic villi sampling, that is called CV S. And they would go from there and then, test whether the child to be born has Down syndrome or not. Again, there's a very small time limit. I think it can be done by in 11 weeks to 14 weeks or 15 weeks of pregnancy, something like that. So the window is early. And so that used to be the norm that time. Right now, although I'm very much, I keep up with research, but with Down syndrome, I haven't. So right now, I really don't know how are they doing the testing. Yes, as Sir has already said, the prevalence in the US is 1 in 700 babies, and the number in India is 23 to 29,000 per year. Now that is a large number, and we need to be aware of what is the diagnosis, what is the condition, what does it entail, and finally they are just like us, we are like them, and we have to treat them. Not only Down syndrome, but I generally treat any child with any disorder just as I would treat and interact any child of the same age. So inclusion is a big topic, for every diagnosis, every developmental disorder. But today we are going to talk about Down syndrome. So the classic features of Down syndrome are, children with Down syndrome are of a shorter height as compared to a child with their same age and same, same age, and then they have a short head, they have a wide head, which is called brachycephalic skull. And there is a flat occiput. I'm sorry for the typo over there. But so flat occiput is called as a brachycephalic skull. And they have a short white head. They have slanting palpebral fissures. That means their eyes. Palpebral fissure is the area of the eye, which is between the two eyelids when the eye is open. So the palpebral fissures are slightly slanted. They have a flat nasal bridge. They have small ears. Sometimes they have malformed ears also. They have underdeveloped jaw. The cavity of their mouth is much smaller if you compare it to a similar age child. And then they have short hands, short fingers. The hands are also broad. And years ago, when I was at NYU, one of my professors actually did a research on children with Down syndrome, and she shared with us where she measured the length of the upper extremity, that is the length of the upper extremity from the shoulder tip to the fingers. And then she compared it, she took that proportion as a part of the body, proportionately how short were they to the length of the whole body. And she found out that a large number of children with Down syndrome, their upper extremities are proportionately shorter. That is what she had found in the research. And I have not seen it anywhere yet, but I would just like to share that with you. And how did this idea come to her? Because she always would see that children with Down syndrome always sit like little statues. They sit like little statues or stand like little statues, and their balance is always challenged. And, their upper extremities are not ready to, catch something or catch themselves when they fall. And therefore, she sort of hypothesized that, they may have shorter upper extremities in proportion to their bodies. Now, this is how children with Down syndrome look. I have taken it from the internet, very lovable. They're very cute. And I think on the left is a picture, and I think it's from Mumbai, where a couple actually adopted this child. And that's such a noble gesture, I would say, such a nice gesture. So this is a child. And as a physiotherapist, I would like to just quickly talk about, they have 3 primary impairments. So they have motor impairments, sensory impairments, and intellectual impairments. So in motor, what affects me in my work is hypotonia. That is, they have low muscle tone, and then they have joint hypermobility. So now watch the word hyper, meaning the joints are a little more loose than what everybody else is. That means they have joint laxity. Hypermobility means their joints are moving much more than a normal joint would. So as a physical therapist, these two things I would keep in mind, because then they have a lot of implications in respiratory and other systems. Okay. Then as a sensory therapist, I've noticed since years that they have sensory processing deficits and vestibular. So vestibular is basically our movement and our balance system. And then proprioceptive is, how aware we are of our body and, the world around us. And then they have visual impairment. So, yes, they have, many of them have the visual acuity issues, and they have visual perception issues also. They have tactile as well as auditory, that is hearing issues. So all of these, the motor and the sensory together interfere with attention, behavior, learning, and function. And therefore, sometimes we find that many children with Down syndrome are very impulsive. On one hand, they look very passive. All the children that I've come across, I think the group of Down syndrome, like they're very passive children, slow children. But at times they can become impulsive. And then there is the intellectual disability, or the intellectual ability varies from mild to moderate mental retardation. Now, when I said passive, I have also seen a couple children with Down syndrome who also had hyperactivity. So, these are just some of the features or some of the impairments that we say seen in most children with Down syndrome, but then, variations can occur. And the other concern I would have while treating a child with Down syndrome is the second point is joint laxity. That is, their joints are hypermobile, and that is why, crashing and things like that we do, or other normal children do, or we do in therapy, I am much more careful about it. And the first point you see here is the atlantoaxial joint instability. That is, they have cervical instability. Because of the joint laxity, the atlantoaxial ligament is lax in most of the children with Down syndrome. And when you're doing things with them in play, moving their whole body, a Down syndrome baby, when you're moving them, up and down, or you're moving them on a ball, or in any kind of play, you have to keep this point in mind that they may have atlantoaxial joint instability. Medical problems, cardiac problems is another one. I'm very, a little bit very careful. If parents have not done the test, I ask them to see a cardiologist, because Down syndrome children are highly likely to have cardiac problems, ventral septal defects, and related to this, they get fatigued very easily. So they may have duodenal stenosis, they may have seizure disorders, and related to hypotonia, again, they may have sleep apnea, they have upper respiratory tract infections. So we have to keep in mind all of this whenever you treat a child with Down syndrome. Find out if they have any of these issues or any of these problems in early childhood, and then you modify your treatment or your treatment plan according to that. And this is a very sweet picture. This was circulated on the internet, I think, a few months ago. In the country of Macedonia, which is in Eastern Europe, there was an 11-year-old girl with Down syndrome who was bullied in school, and other parents, that is parents of other children, complained a lot to the school. And then what happened is, basically, I think what I understood is they didn't want this child in school. So somehow the president of the country came to know about that, and walked with this child to the school himself to set an example. Now, this is such a wonderful gesture, I would say, and it is such a strong message that a head of a country, a president of a country, walks a child to the school, and sends out a very strong message. So I would like to share how I treat, in my clinic, a child with Down syndrome. Very short video of 2 minutes, and then I will end. So this is how I treat. I focus on function. So you see how she's walking there with a broad base. I think this is a point when she had just learned to walk. So I'm making her trunk stronger. See, look at her short hands. But here I'm strengthening her upper body and weight bearing, in preparation for fine motor and handwriting in future. She's a wonderful child. She's a very lovable child, and she's sort of a star of our clinic. Everybody talks to her. So here she's, picking up. I'm having her pick up bottles filled with water. She will pick up, from the basket and put it on the floor, and vice versa. So I'm having her work on balance and trunk strengthening. And when she came to me, this child was not even able to sit on a stool that she's sitting now. And even now, I'm a little careful. Now, meaning when this video was taken, of course, this video is old, but when this video was taken, I'm having an adult sit behind her because I'm not sure when she will just fall back. She would have balance issues. And see how she's sitting with a broad base of support. Now, here again, we are working on trunk again, but we are working on trunk rotation and crossing midline. So this is what we call in physiotherapy, trunk rotation and crossing midline. This also brings in attention. And when we work on trunk rotation, it helps us integrate two sides of our body. Now she's standing on a balance board and reaching from one end, that is her right, to put coins in, this yellow game that we call. And another thing, children with Down syndrome, they're very apprehensive of trying anything new. They want to try, but they are apprehensive because they have issues with balance. So look how apprehensive she is. I have two hands held, and again, she will refuse to do it. She will go away after some time. Okay. But soon they do it. Once they get the experience, they do it. But this is related to their hypotonia and their joint laxity. So you can connect with Active Karya. You can find a lot of information, a lot of nice YouTube videos on my channel. And here I end my presentation. So. I have to minimize. Okay. Okay. Any questions?
Thank you so much, ma'am. We are very grateful to you, ma'am, for having been with us and consented to be the resource person for today's webinar and sharing with us such a beautiful knowledge and enlightening us on types of Down syndrome, what are the features, and especially how do you handle the kids in your organization and all.
Thank you.
I hope all the delegates were able to imbibe the basic information about Down syndrome deciphered through ma'am's presentation. Thank you so much, ma'am.
You're welcome.
And I request the delegates, if you have any queries, kindly drop in your chat box so that we can answer it at the end of the session. Thank you, ma'am. Thank you all. Next, coming to the next session, to decipher the concepts on empowering individuals associated with the persons of Down syndrome, we have a renowned speaker amongst us today for sharing her valuable knowledge and experience. The pursuit of knowledge is never ending. The day you stop seeking knowledge is the day you stop growing. We are extremely glad to welcome the illustrious speaker of the day, Mrs. Tejal Shah, founder of Bangalore Humsafar, Parent Support Group, and Happiness is Kushi, Bangalore, to decipher the talk on empowering individuals associated with the persons of Down syndrome. I now request Mrs. Navita, HOD, Mental Health Nursing Department, RVCN, to introduce the esteemed personality, Mrs. Tejal Shah, ma'am, to our esteemed delegates. Over to you, ma'am.
Thank you, Mrs. Gautami, ma'am. Am I audible?
Yes, ma'am. You are audible.
Okay. Thank you, Ms. Tejali Shah, ma'am, for accepting our invitation and being a renowned guest speaker for today. Ms. Tejal Shah is a proud mother, has spoken at United Nations, and she is a certified special educator. Madam is the founder of Bangalore Humsafar, a parent support group for persons with Down syndrome, and Happiness is Kushi, which is an educational initiative. Madam's will is to empower millions of people who are directly or indirectly associated with differently abled individuals is the vision of Ms. Tejal Shah. The Humsafar and Happiness is Kushi is an educational initiative which develops effective structured programs and courses with top of the ladder trainers who are passionate and dedicated to cause and different areas of children, teenagers, adults, parents, and educators to support and raise aspirations for persons with Down syndrome, autism, learning disabilities, and other developmental delays. Madam has received many awards. To name a few are Madam has received Torchbearer from Down Syndrome Federation of India in the year 2021, the Best Educator Award in the year 2020, an Excellence Award in 2019, and many more in her basket. I would now request Ms. Tejali Shah, ma'am, to proceed with the presentation. Thank you, ma'am. Over to you, ma'am.
Thank you very much. So good afternoon, a very happy afternoon to everyone. I'm so excited to be with you all today, and a very, very happy World Down Syndrome Day to each one of you today. Well, it was yesterday, so I should be saying belated World Down Syndrome Day, but we celebrate our children every single day because they are just simply worth it. All right, so today's topic was supposed to be inclusion, as Uma had asked me to, but then I said inclusion can only happen if we empower families associated with people with Down syndrome, right? So let's talk about empowerment today. And before I start my presentation, I take this opportunity to thank Dr. Rekha Ramachandran, the president of Down Syndrome Federation of India, to recommend me to be part of this seminar today, and Dr. Gajendra Singh for inviting me to present my thoughts on this particular topic. All right, so without further ado, I will start my presentation. And if you have any doubts, please let me know towards the end. Hold on your questions towards the end.
Just listen and see. No, they are calling on.
And before I start, can I request everybody to be on mute because I get really distracted. Thank you. Are you able to see my presentation? Hello, can you hear me, everyone?
We can.
Yes, ma'am.
Yes, ma'am.
Okay, it's opened completely? Yeah. All right, so this is my most favorite subject, and I welcome you all to the world of Down syndrome. So, Madam Ushma has already spoken about the medical part of Down syndrome, so I will not touch that at all because it's already spoken. So let's directly dive into the topic. So how to empower families of persons with Down syndrome? Well, the very, very important aspect which we need to consider, the very first point is by providing right opportunities at the right time. Now you may ask, what do you mean by providing right opportunities at the right time? So number one, the first thing which we need to do, when the child is born, the first thing you need to suggest to the parent is early intervention. You will not, you will not believe the amount of impact it does to any child with Down syndrome. Early intervention is so important that, it reduces the gap which between the child who has not received the early intervention, and you can immediately notice. So what is early intervention? So what does it consist of? regular medical checkups. So, every 6 months is what we recommend, that the child till the age of 5 years, they need to go for regular checkups, as Madam had already mentioned about the different medical conditions which the extra chromosome creates. So those checkups need to be done. It can be hearing issue, it can be eye issue, or it can be thyroid sometimes. So every 6 months till the time of till the age of 5 years, we recommend that every child with Down syndrome does this medical checkup in order to identify if there is any issue. So proper medication or proper support can immediately help the child, to support and not go into further delay. Next is therapies. Definitely, as Madam already suggested, physiotherapy is the most important part for a child with Down syndrome because of the hypotonia which most of them have. So we generally suggest at the age of 1 month even to start off with the physiotherapy because of the hypotonia which they have. Also speech therapy, also occupational therapy. All this is according to the child's requirement. So for that, a proper assessment also needs to be done every 6 months, through which the parent will understand as to where the child lies, and accordingly they develop IEP, which is IEP is nothing but individualized educational plans for every child, which will take care of all the aspects which are required to be considered for the development of the child. And of course, lots of play is so important. Just don't keep the child in the house, expose the child to outdoor play, as I would suggest, and a lot of park visits, and of course, we need to communicate to the child to the maximum. Last but not the least, peer interaction. You will not agree more with me when I say what, if a parent says 100 times, and if a child of a similar age group tells, our children just once, they will get it. So fast they can learn through peer interaction. So go all out and, introduce a lot of children to our children. A lot of typical children interaction should be encouraged to a large extent, because that is very, very helpful for their overall development, especially communication and to learn the regular behavior. So this is what early intervention is. The most important part is what I would say. The next is functional skills, my friends. So functional skills is nothing but the activities of daily living. So once the early intervention is taken care of, the child is a little more aware about himself. Try to involve the child into every activity which you're doing at home. It may be cleaning, cooking, washing, everything you should be involving the child with. And so that's very, very important in terms of functional skills, because that will actually make the child more independent. Next is concept of time, which is so important. As adults, time concept is very, very important. So just you can start introducing time to relating it to every activity which the child does. You can introduce the time concept in that way. The next is money concept, which every person needs to understand in order to survive in this world, right? So that also can be started by buying things for their own family members. That can be a starting step. So these aspects are extremely important to be introduced. And of course, a lot of choices. The parents need to give the children a lot of choices, so that they later on they can take their independent decisions without any confusion. So the training is so important. So every child has potential, my friends. If the right if the right opportunities and right training is being given on time, they will just go on the top. And the last but not the least, which is the theme of this year and forever, it should be inclusion. Inclusion is so important that children with Down syndrome, adults with Down syndrome should be included in every area. Be it mainstream society, be it schools, colleges, and they should be given a lot of opportunities of employment, because that will actually, make them contribute to a large extent to the country, and they will become assets to the country. So that is how inclusion is so important. So we as caregivers have to ensure that this happens. All right, so now what we are working towards. So as Madam already mentioned about me, that my vision is to empower millions of people across the world who are directly or indirectly associated with differently abled individuals, especially Down syndrome, to start off with. So how did I actually start off? So how do we actually start empowering? You may ask, I think Ms. Uma had already asked me to give this response, so I'm addressing it here. So how do we actually start empowering, persons who are associated with people with Down syndrome? So the first thing what we did was to start a parent support group, which is called Bangalore Humsafar, just with 5 parents. So this was just started with 5 parents in the year of 2015. And today we have more than 250 parents in the group, as well as we have lots who are following in the Facebook. So what exactly we do in this group? We share a lot of information, as you can see in my presentation, with parents, and we have all age group of parents in this particular group. So a parent who has just delivered a child with Down syndrome, and also a parent who has a 40-year-old adult with Down syndrome is also part of a group. So imagine the amount of information and experience sharing. It is so rich, and it is so amazing the way parents come out and support unconditionally. And here the parents connect. I mean, everybody shares as to which is the right therapist or any information about schooling. And we also arrange a lot of get-togethers. The biggest get-together, my friends, was on 2017, which was of 92 families. Yes, and it was huge. It was from all across India. In Bangalore, we had organized this. So this is what we do in our groups. We organize a lot of get-togethers. We organize a lot of medical camps. We actually, tie up with different hospitals. If you see, I've mentioned Rainbow Hospital here and also Cloud9 Hospital, so that, all our parents get one-stop solution at one place. Otherwise, they have to keep, going to different places. So this is what we plan every 6 months. And now that it is online, we are doing it more frequently. So yeah, so this Bangalore Humsafar group is actually helping a lot to a lot of parents. And yes, yesterday, because of the Bangalore Humsafar group, we had organized a very big gathering to celebrate World Down Syndrome Day for all our children. And you should have seen the confidence they got, because there was a talent show, we had ramp shows, and we just, celebrate them and appreciate them to do. That is the biggest thing. I think for everybody, appreciation really works, right? So the more you appreciate for their good work, the better you see the results. The next thing which we have done to empower is created an educational toolkit. So, this is actually a very important resource which has been recognized by the Down Syndrome Federation of India, and it has been also published in the International Journal of Special Education. So this toolkit is basically made for parents and educators. So this was created with an idea that, the parents don't lose out their precious time in the initial years researching as to which tool is good for my child to start off with, which is, so much of research is required, right? So this is actually to save their time, and most of the tools which are required during the early age, which helps in overall development, has been included in this, which actually takes care of the processing, perception, reading, comprehension, and also sex education, my friends. So these are all, these tools have been standardized and been just, ready, has been recommended for any child above 2 years of age, so that the parents don't have to struggle and there is a, just, okay, this is what they need to start off with. It is a standardized tool, okay? Yes, so this has been presented all across the world right now. Yeah, and I already spoke about the first medical camp in the world we had organized, because thanks to this pandemic, it was a blessing in disguise for many, because that's how we could help out and reach out to the entire world with parents with persons with Down syndrome and organize this particular medical camp for them, which was so helpful. So we had introduced a lot of the entire medical team from all across India who were ready to support our children. And that is how we have it now very regularly. This is all free of cost we organize. The next initiative, as ma'am had introduced, is Happiness is Cushy, wherein we develop effective programs, courses with top of the ladder trainers who are passionate and dedicated to the cause. We actually take people who are really dedicated to the cause, because that's how they give unconditionally. And then, we actually gel better with them. So on different areas for children, parents, and educators to support and raise aspirations for persons with Down syndrome and other developmental delay. All right, so the reason of this educational initiative is my beautiful daughter, Kushi, who is the reason of this particular initiative, because she is doing so well for her age that I feel proud to share that she was called at the United Nations yesterday to give her thoughts on inclusion. So it was a World Down Syndrome Day in association with United Nations, with the Down Syndrome International UK, wherein she was she had spoken about inclusion, her thoughts on inclusion. So that is how, my friends, I wanted to show the pictures of her, because this is what we have done with her. The early intervention, it has really worked well with her. She goes to a regular school. She does cycling, yoga, swimming. And that is what motivates me to reach out to more and more parents and inspire them that our children are totally worth it. With the right opportunities, they just go, places. So the next initiative which we start, which is the most important, the first formal course which was not there, which was launched by Dr. Rekha Ramachandran in 2019, was the first formal course on Down syndrome. This, my friends, you should recommend to every parent whom you meet, because this has all the information which a parent or an educator who is connected to a person with Down syndrome to help them develop in all aspects. So this gives an insight into the lives of all children and adults with Down syndrome. We actually cover every aspect in this particular course, so it's actually a boon. So we have trained more than 150 participants as of now, and we have run 3 batches till now. So please recommend to anybody and everybody, because this has been done for the first time by the Down Syndrome Federation of India under the guidance of Dr. Rekha Ramachandran. The next initiative was, so yes, this is what, it's all about the Down syndrome course. So it's actually online. Earlier we had started offline. And then because of the pandemic, we have done it all online. So anybody from across the world can join us. And we have had a lot of countries joining us for this course and have benefited to the maximum. The next course, my friends, is communication skills. This is so important, right? In the early years, as I mentioned already during the early intervention. Now, how to develop communication skills? If you notice, for our children, the speech is a major issue. But if you know the right techniques at the right time, you can do wonders with the child. So this course consists of complete details of how to enhance speech, language, vocabulary, expressions for a child with Down syndrome and autism also. So this is also highly recommended for anybody and everybody who works. So we have had doctors, we have had parents, we have had educators who have been part of this particular course. So all our courses are for parents, educators, and teachers also, because we believe in empowering everybody. Only then we can see an inclusive world. Because if we just restrict to parents, then we cannot see inclusion. It has to be people who are not associated directly with people with Down syndrome, who are just typical and have no clue about this world of special needs. If we include them, only then we can see inclusion happening in the real sense, right? So yes, we have also started sing-along programs. So this is also important during the early intervention. So that is how we have actually formalized these courses, because because then the parents understand the structure and they know, okay, this comes after this we need to do. And there is no gap. We do everything possible, okay? And then there is no looking back. Next is the maths. So as we all know, maths is a struggle for a lot of our children, not only our children. I mean, any child, maths is a struggle if it is just taught in a very regular way, in a classroom style. So what we do here is we bring a lot of different fun techniques. We bring movement in teaching. We bring different methods in Waldorf methods. So they're all fun-based learning, hands-on activity, experiential learning when we talk about this kind of course. So that's how we've introduced all these courses. So it's just that the parent takes the course and understands the entire thing, and they are ready with the structure, and they are ready to work with the child, or understand the child's requirements better, because they're so full of ideas after doing all these courses, right? And next, this was a recent one, which was also spoken, was actually selected in the Guinness World Record, but could not go into publishing because they need a certain number before they actually publish. So they need like 1,500 students already trained. But because why did they actually think about this? Was because there was no other science program for children with Down syndrome or any other special needs in the entire world happening in this way. So imagine, this is so important, because our children learn everything with experience visually. They are all visual learners. So this kind of programs have actually make them understand the concept of science so well, because they are experiencing it. They're doing different experiments in this particular program. So, and this also has, different age groups. We start from the age of 8 years, and we have had students of 35 years. They had not had science in their schools. Can you believe that? I mean, how much we underestimate our children. And they are so capable. You should actually be part of the science program and see how beautifully they explain the experiments, and they understand the concepts of cloud formation, rain formation. I mean, it's beautiful. Yes, so that is all. And the next initiative, this is what we just recently started. It was a super hit, because a lot of our children lack friendships, So what we have decided was fostering friendship among people with Down syndrome. And as of now, we just had it like a couple of months back. We started this initiative, and we have created like 35 pure friendships, and they just speak out their heart. So this is so beautiful. We are just trying to increase it the more, because it really, really helps us. It's the biggest gift which we can give to them. And we are always designing new programs for empowering, and we are always thinking for the benefit of the parents and educators who are associated with our children. So now we are next coming up with the drama, because drama expressions are so important for, the overall development of the child. Because if you notice, people with Down syndrome, understanding is far better than the expression. So if these kind of programs are being incorporated since an early age, they will do just bang on. And we're also designing programs for employment, like design and garment construction. So these are all training programs that are under pipeline, so that they can actually get jobs in future. And these are all under construction right now. So this is what I wanted to share with you. And thank you very much for listening to me. You can reach out to me on my email, my website, happinessiscushy.com, and on my call anytime. If I don't pick up, I will call you back definitely. Thank you very much. Yes, I am done.
Thank you.
Thank you so much, ma'am. We are really grateful and delighted to have you being with us and consented to be the resource person of today's webinar. Ma'am, kindly I request you to stop share the screen, ma'am. Thank you, ma'am. Thank you so much. And for delivering us and highlighting us on early interventions required and the functional skills required to make the child independent, and explaining us the importance of educational toolkit and sharing your live experiences with the kids who are suffering from this Down syndrome. And we are really proud of you to hear the initiatives taken up by you for children suffering with Down syndrome.
I'm so sorry to interrupt. Can we not use suffering from Down syndrome, because they are really
Okay, children with blessed
they are blessed with Down syndrome, because they're actually not suffering. To be very frank, they are just having the time of their life. You should come to me and see the children I work with and I be with. They are just enjoying and having the best of the time. So let's use the word blessed.
Yes.
Yeah, actually, in my opinion, any child with special needs, we should not use the word suffer, because, we have to, if we are talking about inclusion, if we are talking about empowerment, then the words that we choose matter. So, and we have to recognize that, they are just one of us, and that's why they are not suffering something special. We are also suffering, for that matter. We are, each one of us suffers from so many other things in life,
Yes.
So suffer is not a good word to use. So I agree with, Tejal over there.
Yes, ma'am. And sorry for it. Actually, the children who are blessed with this Down syndrome and all those things. And we are really proud to hear from you, ma'am, the initiatives which you have taken up for the children with this Down syndrome, and even for the caretakers as well as for the relatives, that especially what sort of care has to be provided to the children with the Down syndrome and all. We are really thankful to you, ma'am. Now the session is open for the queries from the participants. I request the delegates to put forth their any queries to the resource persons. Ma'am, there is a query from Sureka that she has posted in the chat box. Ma'am, my daughter is 13 years old. She was hyperactive. She was affected by dengue and has joint problems, and now has standing and walking problems as well as balance problems. Kindly advise on it. I request any one of the speaker to answer to this question, ma'am.
Yeah, I think Ushma ma'am will be better on balance. So let's.
No, you can also answer, because
No, ma'am, you're the expert in physiotherapy.
no, the thing is, so I think the person who has asked this question, the child is now 13. I mean, like a teenager almost. That's what I believe, right? Yeah. So, and she had dengue. That's thing. So, after certain what you call illnesses like dengue, and which is the other one, the chikungunya, and even now COVID. Actually, many of us, the effects last much longer than the illness itself, and the most observed effect is on the joints, the joint pain. So since this child is 13, she's already gone through dengue. I would expect that she would have a lot of joint pains, and therefore it would impact her balance. I think that was your question, balance, and what else? Her balance, because her joints would be painful. And and she's also going through a stage when her body is growing, her bones are growing at a very fast stage than ever before, that 12, 13, the pre-adolescent and the beginning of the teens. So you cannot write off that factor, you cannot ignore that factor either. So if I were to see this child, I would still continue with a lot of everything that, I do, like, daily functional skills, daily mobility, through whatever, is appropriate for her age, at 12 or 13, but in a slow manner, then with, it has to be paced out, meaning you need to give a lot of breaks to the child while doing all these activities. And I would also consult a medical doctor, because if she did not have medical doctor or an orthopedic or x-ray or something, because if she did not have these pains or this problem before the age of 13, why is she having now? One factor is, yes, the dengue. One factor is the growth, sudden growth spurt. But yes, I would, definitely. But I would not put the child on bed rest or not let her move or, those things, unless the joints are swollen or there is a urgent medical concern, because for no child, even all the special needs children who have medical concerns, we generally in this modern age, this day and time, we don't really recommend bed rest as such. We just recommend slow down, pace out, consult orthopedician or a neurologist, as the case may be. I think you have to consult a pediatric orthopedist. Okay. Does that answer my question?
Sureka, ma'am.
Good afternoon, ma'am. Thank you for such advice that you're giving us. I have consulted the doctors and they're telling her to keep her as active as possible. So I'm just taking her for some, slow walks and little bit of activities at home.
Yes, so that's why I said that we never stop mobility. Now, keep her as active as possible is again like a broad word, right? Which we all say, keep as active as possible. But as a parent, because she's only 13, so she understands and yet doesn't understand much maybe about her body. So as a parent, you need to monitor, how much does she walk per day? How much does she move per day? How much does she rest? Rest as in sitting and rest as in lying down also, because there are two different, if she's too tired, she may even lie down more than what she would have done before her dengue or
after
recently.
This COVID, no, she's
long,
stamina is reduced, I feel.
Yes, I really don't know how much of hypotonia your child may have at this time, or how much. So we can't change hypotonia as much, but we can change through therapies or exercises or functional activities. We can change the way they use the muscles. So that way you can influence the muscle tone. You can't change it much, but you can influence the muscle tone. So COVID, the muscle tone is all over the body, right? So the chest muscles also have hypotonia, and that is where our children with Down syndrome have difficulties with speech, upper respiratory tract infection, because the chest muscles, the COVID itself is a respiratory condition in some sense. And plus, if the child has hypotonia, so breathing exercise is the other one. I'm a big believer of breathing exercises, and breathing exercise learned from a physiotherapist. So I don't have any issues with pranayama or anything we do, because even the physiotherapy breathing has come or has been drawn from the pranayama. However, in physiotherapy, they modify the exercises a little, the breathing exercise in a little funnier way, in a playful way for a child. And, they monitor. When we do breathing exercises, I do at least monitor the SpO2 and the heart rate, and, to see the response of the child, So that is what breathing exercise is, because breathing exercise is meaning you are strengthening your chest wall muscles. You are changing your breathing pattern for the good. And, better breathing means better air, means better oxygen. And oxygen is a fuel that we need just as we need food, We can't live without oxygen, just like we can't live without food. So sometimes breathing exercises make, particularly exercises along with breathing exercises done the right way by a physiotherapist, make a big difference. Okay.
Thank you, ma'am. Thank you.
You're welcome. You're welcome.
Thank you, ma'am. Any other queries from the delegates? The session is open up for queries.
So, Ms. Anita, I think there are a lot of people who have asked about the program, so they can always get in touch with me regarding which program, so I can give further details, or they can see my website, www.happinessiskushi.com. So they will get all.
Ma'am, can I ask a question?
Yes.
Myself, Subhagini Sahu, the mother of parents, Down syndrome, baby, age 37 years old. Actually,
Yeah,
hi.
Yeah, Rashmi,
Ma'am?
Rashmi is your daughter, right?
हाँ रश्मि की मामी बोल रही हूँ
Okay. The famous Rashmi, yes.
लेकिन अभी 2-3 साल हुआ है अभी थोड़ा अटैक हो रहा है 1 मंथ में हम किसी के पास जाएंगे डॉक्टर माने साइकेट्रिक या पीडियाट्रिक या मेडिसिन हम आई कांट अंडरस्टैंड दिस सिचुएशन
नहीं क्या
इट इज हैपनिंग
सॉरी आपका क्वेश्चन नहीं समझ में आया मुझे
नहीं मैम वो राशि हो रहा है एपिलेप्सी से अभी 2-3 साल हुआ है एपिलेप्सी वो 1 मिनट 2 मिनट का थोड़ा छटक झटक हो रहा है ज्यादा टाइम नहीं रहा है लेकिन भाई इट इज हैपनिंग ओके और हम कोई किसी डॉक्टर के पास ले जाएं साइकेट्रिक डॉक्टर या मेडिसिन डॉक्टर we cannot understand in this situation.
आपको न्यूरोलॉजिस्ट को मिलना पड़ेगा वो आपको और डिटेल्स देंगे और उसके बाद आप साइकेट्रिस्ट से मिल सकते हैं फर्स्ट इज न्यूरोलॉजिस्ट क्योंकि वो एपिलेप्सी के बारे में आपको ज्यादा डिटेल्स बता सकते हैं सो आप प्लीज न्यूरोलॉजिस्ट से बात करें मैं आपको कांटेक्ट डिटेल्स भी दे सकती हूँ आप मुझे मैसेज कर दीजिएगा
Okay, thank you so much.
Yeah.
Okay.
Thank you, ma'am. Ma'am, there is one more question from Sarita.
Yes.
Ma'am, is there any rehabilitation institutes available in Bangalore?
Regarding for our children, there's so many, no? For residential purpose or for therapies or what exactly is she asking?
Sarita, ma'am.
Yes, ma'am.
Ma'am, you can
like
your question.
I read it out for early interventions. Any institutions is there in Bangalore?
Yeah, there are so many.
There are many.
Yeah, there are many. You can just message me. I will give you all the details. Okay, where are you put up? Where are you put up?
Ma'am, from Kolar. Yeah.
Okay. So I will connect you to the group. Yeah.
Sure, ma'am.
Yeah.
Thank you, ma'am. Any other delegates? Any queries from your end?
Excuse me, ma'am.
Yes.
Ma'am, the institutions are like by government agencies or is it private agencies, ma'am? Like private institutions or is it government institutions?
Which one? For the rehabilitation?
Yeah, for rehabilitation and early initiations for this.
Yeah, there are both. Both are there. Private are lots of private are there. Even government are also there.
Yeah.
Yeah, both are there.
Yeah, you have to find one that suits you and suits the distance, between where your location and the institution. Because I always recommend that any child with special needs should not be traveling too much. That even if it's twice a week, once a week, but not traveling. Too much.
Okay, ma'am. Okay, ma'am. Thank you.
Thank you, ma'am. Any other queries from the delegates? Okay, I think as of now, no queries from the delegates, ma'am. And the session was so beneficial to all the delegates. They don't have much queries about the sessions. Okay. Hope everyone has benefited and had a competent as well as fruitful takeaways from today's session. Thank you, Ushma ma'am, as well as Tejal Shah ma'am. Thank you so much. Let us be grateful to the people who made us happy and their charming gardeners who made our souls blossom. Now I request Mrs. Uma Maheshwari, HOD, Child Health Nursing Department to set the food to propose vote of thanks. Over to you, ma'am.
Thank you, Gautami ma'am. A warm greetings to one and all. Being thankful and expressing our gratitude is an important part of being happy in life. On behalf of RV College of Nursing, I owe my special thanks to all the delegates from various institutions and various organizations and parents. Your presence made this session more fruitful one. Thank you all. Without you, the event would have not been success. Thank you and thank you everybody. Next, I extend my sincere thanks to our speaker of the day, Dr. Ushma Goradia, founder of our Active Korea, Bangalore. Thank you so much, ma'am, for accepting our invitation, and thank you so much for the wonderful session, ma'am.
Thank you for inviting me. Thank you for inviting me.
Thank you, ma'am. Thank you so much, ma'am. I deem it as a great honor in thanking our next resource person, Ms. Tejal Shah, founder of Bangalore Hamsafar, Parent Support Group and Happiness is Kushi, Bangalore. Thank you so much, ma'am, for your wonderful interactive session.
Thank you. It was an amazing session. I really had a good time. Thank you for inviting me.
Yes, ma'am. Thank you. I extend my heartfelt thanks to our beloved principal, sir, Dr. S.R. Gajendra Singh, RV College of Nursing, for supporting and encouraging us. Thank you so much, sir. Also, I thank Professor Mamta Nischal, HOD Department of Medical Surgical Nursing, and Dr. I. Clement, HOD Research and Development. Thank you so much for all your support and guidance. Next, I thank all the HOD and faculty, student of RV College of Nursing for all their support and guidance. I owe my special thanks to the principal and faculty of the other colleges for encouraging their students to attend this webinar. Thank you so much for all the faculty and the principals of various institutions. Also, I owe my special thanks to Dr. Surekha Ramachandran, who've been like the guest of the today's session. Thank you so much, ma'am.
Yeah, I think she just left.
Yes, ma'am. Thank you so much, ma'am. Thank you all once again. Thank you for your valuable participation. Thank you once again.